Let's welcome our next speaker, Heather Doss with U of A AZ Poison and Drug Information Center. Heather's going to be doing a presentation.
Heather Doss is one of the community outreach coordinators for the Arizona Poison, Drug, and Information Center. In 2022, she earned her master's degree in public health with a concentration in health behavior and health promotion from the University of Arizona. She also has a master's degree in biomedical science and a bachelor's degree in biology. Previously, her experience has been related to addressing nutritional disparities in tribal communities.
Awesome. Looks like, Heather, you've already turned on your video. Feel free to take over whenever you want.
Hi, everyone. Thank you for the introduction. So I'm going to go ahead and share my screen. All right, so I think that you should be seeing that there. And I'm going to go ahead and get started. So as you heard, I am one of the community outreach coordinators for the Arizona Drug and Poison Information Center, Arizona Poison Center for short. So my primary role is doing community education, so participating in a wide variety of things. So we do participate in health fairs, we give talks at schools and even at the university, or giving talks like this, like I'm doing here today. And then the other coordinator and I also manage our social media platforms. We post a lot of prevention messaging there as a way to reach community members. Social media seems to be the thing that a lot of people are on these days, and that's where they're getting a lot of their information. So we're doing our part to put information on there as well. So I'm going to go ahead and get us started. Some of the things that we're going to talk about today include just a brief history about our poison center specifically, and then a little bit about our poison center and poison centers in general. And then I'll go into talking about some of the venomous and poisonous critters that we have here in Arizona. And then I will transition into talking about the nitric acid transport spill that we had here in Tucson, and just talking about that in a way to provide an example of how we would respond, how the Poison Center would respond to an environmental event that occurs like that. And then I'll end off with talking about calling the Poison Center and what somebody should expect when they do call the Poison Center. So our history dates back to the 1950s. At that time, a lot of new products were entering the market. And with that came new exposures that healthcare providers weren't exactly sure how to approach and how to manage an exposure. So they called on Dr. Piccioni here from the University of Arizona to develop a library of products and ingredients in toxicology. So those were actual physical cards that had, it was made per product. And on that card, it would have information such as the ingredients of a product and what were the active ingredients, what symptoms would one expect with an exposure to that specific product, and then how an exposure could be managed. And those cards were duplicated and sent to healthcare facilities across the state. And then in 1955, our center was the second poison center to open in the United States. And of course, that is here in Tucson. In 1980 to 81, that's when we officially received legislative funding from the state and were declared a regional poison center. And then fast forward to now, 2023, this is our 69th year of service. And we're known as a center of excellence, a regional hub for toxicology, teaching, and of course, saving money and lives of those who do call our center. So a little bit about our center. We are one of two poison centers here in Arizona. So we serve 14 out of the 15 counties. So that's every county in Arizona except for Maricopa County. Maricopa has their poison center there that they are served by. And our center, as well as all other poison centers in the United States, are open 24/7, 365, and it's completely free and confidential to call us. Our number, which is the national number, is 1-800-222-1222. That QR code that you see on the corner of the slide, you can scan that to save the poison control number to your phone, and you'll just have to click Add New Contact. And as I mentioned, that is a national number, so you can call that from anywhere you are in the United States, and you'll be connected to a poison center. Calls are routed based on your area code. So for example, if you have a 520 number, you'll be connected to our poison center here in Tucson. Whereas, for example, if you have an area code that's from Maricopa County, you'll be connected to the poison center there. But if, for example, you live here and you have an exposure that's here in Tucson, but you have, again, a Maricopa number, they can reconnect you to our poison center here if that's where your exposure occurred. And our staff includes physicians, pharmacists, genetic counselor. So we do have our mother to baby program that is a part of our poison center, and our genetic counselor facilitates that. And then myself and the other educator, we take care of the community education side for the poison center. So the top 10 exposures that we saw last year for our center specifically were the following. So analgesics, which are painkillers, and this was actually the most common exposure for all age groups. And then we have that followed by bites and stings, which we'll be talking a bit about today. Then household products, antidepressants, antihistamines, cosmetics and personal care products, sedatives, hypnotics, and antipsychotics, cardiovascular drugs, alcohols, and dietary supplements, herbals, and homeopathic products. All right, so now I'm going to get us into talking about our venomous and poisonous critters that we have here in Arizona, starting off with the scorpions. So if you see the top picture, you see the three different kinds of scorpions. So the far left is a giant desert hairy. The one in the middle is a striped tail, and the one on the far right is a bark scorpion. The one on the far right, so the bark scorpion, it is the smallest one, and that's the one that we worry about the most here in Arizona. It is the clinically relevant one. So there are 30 plus species of scorpions in Arizona, and last year there were 917 stings reported to our center. And as I mentioned, bark scorpions are the only clinically significant species that we worry about, and we'll discuss why in a second. And then all scorpions glow under a UV light. So if you can see the picture that's on the screen, this is a picture of a mother scorpion with the babies on her back. So the mother scorpion is fluorescing a teal color. And in order for scorpions to fluoresce in that way, they need to have their exoskeleton fully developed. So the babies don't have that fully developed just yet, and that's why they're not fluorescing in the photo. So scorpions are relatively inactive during the daylight hours, and a majority of the stings that are reported to our center are stings that occur at night and during the warmer summer months. And these guys prefer unbothered areas of debris, trash, maybe piles of logs and brick piles. And then when they do get into the home, they can be found in places like closets, in bedding, and sinks and tubs. All right, so bark scorpions are less than 2 inches in length, and because of their small size, they are often mistaken as baby scorpions. Maybe you've heard of people saying that the babies are the most dangerous, but that's not true. They're probably talking about the bark scorpions. Even as, full-grown adult scorpions, they are very small in size. And scorpions can climb surfaces like walls, but they cannot climb plastic or glass surfaces. So one of the things that we recommend, especially for children, is putting the legs of the bed or the crib inside of a glass or plastic container and having the furniture removed a few inches from the wall so that the scorpions cannot climb up and get into the bedding. Because it is quite common that the stings that are reported to our center occur when somebody has gotten into bed and they don't know that there is a scorpion in the bedding. And then the venom from bark scorpions is neurotoxic. So the symptoms that are seen with these are some neurotoxic symptoms. So getting into the sting side effects and treatment. After the sting, a person will typically experience general pain and numbness, and that numbness can radiate. So, for example, if somebody is stung on the hand, it could radiate all the way up into the shoulder and the armpit area. And the person can also experience burning and stinging. And that is typically the extent of symptoms that we see in adults. However, in children and people who have an allergy to scorpions, they will likely experience more severe symptoms, and these include involuntary jerking movements, rapid eye movements, muscle twitching, drooling, and difficulty breathing. Again, these are symptoms that are most common in children, and these are the neurotoxic effects of the venom that's producing these symptoms. And then in terms of treatment, typically scorpion stings can be treated at home. And that just includes using a cold compress and an over-the-counter pain reliever to mitigate the pain. But for anybody that's having an allergic reaction or a child that's having a more severe reaction to the sting, they will likely have to go to the hospital to receive supportive care, which includes airway management, as well as stronger opioids to mitigate that pain, and then also receive antivenom, which is called Anascorp, and they will likely need anywhere from 3 to 5 vials. And then some prevention tips to prevent scorpion stings include checking clothes and shoes, especially anyone that leaves shoes outdoors, maybe people that are leaving work shoes out on the porch, things like that, making sure to shake those out before putting them on, checking the bedding, avoid being barefoot outdoors. These guys can be hard to see outside. So just making sure that you're never walking around outside barefoot outdoors, wearing gloves when working in the yard, gardening, doing any kind of work outside. And then as far as the home, making sure to scorpion proof that home. So that means sealing up any cracks in the foundation and making sure that entryways are sealed. So for example, sealing up any cracks along the window seals or along the doorways. That way these guys cannot get into the home. And then just maintaining areas around the home and housing complexes. So like I mentioned earlier, they tend to like unbothered areas or areas of debris. So making sure to eliminate those things as well. All right, so now we're going to get into talking about rattlesnakes. So we have about 15 species of rattlesnakes in Arizona. Last year, there were 172 bites reported to our center, and there were 280 bites reported nationally to poison centers. So as you can see, that's over half of the bites occurred here in Arizona. So one of the things in preventing snake bite includes being familiar with rattlesnake behavior. So knowing that snakes use camouflage to hide in areas of like shrubs, beneath rocks, and also in different debris. So if you look at the second picture on this slide, the bottom picture, you can see that there is a snake in the middle. If you are able to see it, you can see that its coloration is very similar to the terrain that's around it. So it does blend in very well to its surroundings. And also want to note that rattlesnakes can strike without rattling, and they can strike up to half of their body length. So listening for a warning sound from a rattle isn't always effective because they can strike without any kind of warning. And they are most active in the summer. So most of the bites that are reported are we see peak snake bites occur in August and September, but snakes are active in March to October. So we are kind of in the later part of rattlesnake season now. But as we are getting into the colder months, you should remember that even though the temperatures are cooler, a sighting isn't impossible. So you should always be aware of your surroundings and making sure to never reach into things or put your hands or feet where you can't clearly see what's there. So some snake bite stats for last year. So looking at the graph on the left, you can see that the older adults, age 50 and over. Most bites occurred among this age group, and that is because this age group tends to be the group that has more outdoor activities, outdoor hobbies such as gardening. And then some of the common circumstances where we see people are being bitten is everyday things like checking the mail, throwing out the trash, and even just going in and out of the home. Maybe that's going inside, from walking inside from the car, things like that. And then on the graph on the right, you see total cases over time. So in April was when we saw the first peak last year with 18 cases, and then it peaked again in August and September. So in August, there were 40 cases reported, and in September, there were 38 reported last year. So some tips for snakebite prevention. So as I mentioned earlier, watching where you put your hands and feet and be aware of your surroundings. Wear appropriate clothing for outdoor activities. That means wearing closed-toed shoes, long pants, wearing some gloves if you are going to be doing any kind of yard work, gardening, any kind of work outside. And again, maintaining the areas surrounding the homes or housing complexes. Never handle a snake even if it's dead. Snakes can reflex strike for several hours after they have died. So you never want to handle a snake. If there is a situation where you need a snake to be removed, the fire department can remove a snake for you. And then there's also a service that we have, and it's called Rattlesnake Solution. That's here in Tucson. And they do have a fee associated with that. So we just want to note that. And then just knowing the peak activity times that we just talked about. So knowing they are most active in March through October, and that they do prefer those summer months and the warmer temperatures. When it's warm and nice for us to want to be outside, that's the time when they're also out moving around as well. So now the do's and don'ts of snake bite treatment. So we don't want to do anything that we see in the movies or TV shows. That means never cutting the wound. That puts you at risk for greater tissue damage. And of course, avoiding trying to suck out the venom. Again, puts you at a risk for tissue damage as well as potentially an infection by introducing bacteria to the wound. Avoid using tourniquets or tight bandages. You want to allow the blood to free flow, and then there will be some swelling. There will be a lot of swelling, so you don't want to use anything that's going to cause any restriction. Never apply ice or electric shock or burn the area, or drink alcohol, and also avoid applying herbal remedies to the area, and avoid waiting for the symptoms to show up or get worse. So in some cases, symptoms can show up several hours after a snake bite has occurred. But you don't want to wait until symptoms show up to go to the hospital, because that would also put you at a greater risk for tissue damage and damage that can't be reversible. And the things that you do want to do is remain calm. So snake deaths due to snake bites are rare here in the United States because we do have anti-venom that's available. You want to walk to safety as needed. Don't run or panic. So for example, if somebody's out in a remote area and they've been bitten, they don't have cell service or don't have access to a phone, you want to make sure to calmly go to an area where you can either get cell service to call somebody, or access a phone, or get somebody who can call for help or call an ambulance to come and get you. And then remove any restrictive clothing, shoes, or jewelry. And again, we don't want to do anything that restricts blood flow. And also, again, there will be a lot of swelling. So removing anything that's restrictive, holding the bitten limb level with the heart if possible, and then seeking emergency medical attention as soon as possible. So the only thing that will help a rattlesnake bite is anti-venom, and the only place that is available is at the hospital. So making sure to reach a hospital as soon as possible. All right, so now getting into Gila monsters. So Gila monster bites exposures are quite rare. Last year, there were only 2 reported to our center. These guys are pretty shy and non-aggressive and slow-moving. They're not going to chase you if you're around them. They might open up their mouth and hiss to let you know that you're getting a little too close and let you know that you should apply some distance, so take several steps back from the animal. These guys can grow up to 2 feet in length and weigh 4 pounds, and they are a protected species here in Arizona, so it's illegal to catch them, sell them, trade them, keep them. And they are found in the southwestern region of the United States, and the bumps that you see on the skin are actually a part of the skeleton. So those bumps are little bones that are a part of their skeleton, and that's sort of a characteristic trait that they're known for is their skin. So symptoms of a bite include burning pain and swelling that happens in the first few minutes after the bite occurred, and that's typically followed with weakness, feelings of faint and dizziness, as well as sweating, nausea, vomiting, chills, and fever. So if someone is bitten, the first thing to do would be to make sure that the lizard is removed as soon as possible. And then first aid includes irrigating the wound with water, making sure to clean out the area of the bite. Again, immobilizing the limb at heart level and seeking medical attention. So there is no anti-venom for a Gila monster bite. It would just be the care and management for a bite would just be to keep an eye on the wound to make sure that it's not being infected, and also perhaps exploring the wound to make sure that there aren't any teeth that have been left behind. And next we have bees, wasps, and hornets. So last year, there were 102 bites reported, 102 stings reported to our center. And the Brazilian or Africanized bees are the ones that we worry about the most. These are extremely aggressive and they swarm very frequently. And if anything happens upon a hive and irritates them, they will swarm and follow whatever it is that has agitated them. So the symptoms of a sting include pain, swelling, redden, and itching. That's typically the extent of a sting that we see for one sting, and in somebody who is not allergic. So in those who are allergic, they do experience anaphylaxis, so trouble breathing, swelling, things like that. And it is important to remove the stinger as soon as possible to avoid continuous venom distribution. So previously, it was recommended to use something with a flat edge, but really it's just using whatever you have available to remove the stinger as soon as possible. And in severe cases, these are typically cases where there were upwards of 50 stings, is when we start to see more severe symptoms that include nausea, vomiting, and fever, fatigue, kidney failure, and these are cases where medical evaluation is always required for the management of the sting and managing any symptoms that are appearing. And our last critter that I have here is the Sonoran desert toad, and this guy is actually poisonous rather than venomous. So if you see circled on the photo, that is the parotid gland, and that is where the toxin is made and secreted, and it is a cardiac glycoside, so it can have effects on the heart. Human exposures are not as common. So last year there were only 23 reported to our center, whereas there are more animal exposures that occur. So last year we had 42 animal cases. And one of the reasons that they are more common in animals is because, for example, dogs, if they see these guys, they'll want to play with them, lick them, and that's how they become exposed to the toxin from these toads. And these guys are most active during the monsoon season, which coincides with their breeding season. So in the late summer is when you would probably see more of these guys out and about. All right, so now I'm going to shift gears into talking about the nitric acid spill and the role that our poison center had in response to this event. So briefly going over nitric acid, it is a colorless liquid that has yellow or red fumes and a strong odor. And symptoms of exposure include eye, skin, and mucous membrane irritation. And then with further exposure, symptoms include delayed pulmonary edema, so buildup of fluid in the lungs, as well as lung inflammation, and which is pneumonitis, and bronchitis, which is inflammation of the bronchial airways, as well as dental erosion, as this is a highly corrosive substance. So the role of the poison center. So our toxicologists here were able to identify the substance involved in the spill as nitric acid because of the color of the fumes. And because of that, they were able to give proper recommendations to patients calling in or patients that hospitals were calling in about. They were able to give proper treatment and management advice to hospitals. And our center started receiving calls about 15 minutes after the emergency alert was sent out on cell phones. And between the dates of February 14th of this year and March 10th of this year, our center received and managed 125 calls associated with this event. 77 of those were exposure calls and 48 were information calls. And then of the exposure calls, 8 were referred to a healthcare facility, while 11 of those were already in a healthcare facility, and then 58 were managed at home. And then of the information calls, 7 were from a healthcare facility, so from a hospital or another healthcare facility, and then 41 of those were information calls from people at home. And so when an environmental event like this occurs, our center would just collaborate with various local and state organizations. So for example, we collaborated with the health department to put out some guidelines on precautions to be taken, as well as what to do if anybody started experiencing symptoms. And then we also, so as I mentioned, we put out this information to the public, and then we also had this information available on our website. And then we also provided links from our social medias to our website where that information could be accessed by the public. So using the various methods of media outlets to be able to reach the public and provide the most up-to-date information. And then, of course, just managing of exposure and information calls from the public and healthcare facilities, and providing any kind of treatment advice that healthcare facilities were needing. And then finishing off with calling the poison center. So the different things that people can call the poison center include poisoning. So if something has already occurred and they need treatment advice, or if they have a question about medications. So for example, medicines is of course another topic that we manage and receive calls about. So for example, if somebody has a question about how much medicine they should be taking or what to do if they accidentally took 2 doses of their medicine. Those are calls that we can manage. And then, of course, bites and stings and any symptoms that a person is seeing. And then, of course, remembering to call 911 immediately whenever somebody is unconscious, they're having trouble breathing, they're not breathing at all, or maybe they're bleeding or seizing. And then what to expect when you do call the poison center. So the specialist that answers your call will ask a series of questions to assess the severity. So for example, if it's a call where somebody has consumed something, they will ask questions such as how old the patient is, what exactly was consumed, how much was consumed, how long ago, and what symptoms, if any, are being seen. And then from there, the specialist will provide treatment recommendations. So if it's something that can be managed at home, the pharmacist will instruct you on what to do in order to manage that situation at home. And then if it's something that needs that the patient needs to go to the hospital for, the pharmacist will instruct the patient to do that as well. And then they will continue to monitor the case. So if it's something that's being managed at home, the pharmacist will do follow-up calls to ensure that the patient is progressing as they should and making sure that the situation hasn't turned into a situation where the patient needs to go to the hospital. And then for anybody that is admitted here locally, for example, here at Banner, toxicologists might come and see the patient at the bedside. And then also the care team from the hospital can also call the Poison Center to ask for additional treatment recommendations. So that is all I have for today. Any questions, I'll take those. So if anybody wants to unmute or put them in the chat. And then my email is also available on the screen for anybody who has any further questions.
Thank you so much, Heather. We do actually have a series of questions for you today.
Okay.
All right, we're just pulling those up. Top question right now is somebody asking, what is the difference between venom and poison?
So venom is something that is injected. So a rattlesnake is venomous and scorpions are venomous because they do inject either with the fangs or the stinger. Whereas something that's poisonous is something that is either consumed, inhaled, splashed in the eyes, or on contact with the skin that has an adverse reaction.
Awesome. The next question here is it true that you shouldn't use tweezers to remove the stinger because you could squeeze more venom out?
So that could cause more venom to disperse. However, if tweezers is the only thing that you have to remove a stinger, you would want to go ahead and use that because leaving in the stinger will, of course, also allow for more venom to be distributed into the site.
Makes sense to me. For snake bites, why should the limb be kept at heart level as opposed to lower than heart level?
So that would just help with blood flow to hold off any kind of swelling. So extensive swelling will already occur, but the more able that the blood is able to free flow, that would hopefully bring down any swelling that's occurring and keep it from becoming more severe.
Okay. What is the basic guide for you if your dog does come into contact with the toad?
So you would want to make sure to rinse out the dog's mouth, making sure that the dog doesn't swallow any of that water that's being used to rinse it out because they would be swallowing the toxin. You could also take a wet paper towel and wipe out the mouth, so all sides, top to bottom. And then the toxin is a cardiac glycoside, so they would need to go to the vet for that.
Is that something just any vet would be able to handle, or?
Yes. And then also we also want to note that we do accept calls for pets, but there is a separate poison line for pets, and it's a different number, and they do have a fee associated. But if it's something minor, our specialists will likely be able to advise in those situations as well.
Oh, awesome. Can you have long-term problems from a scorpion sting for those who are allergic to the venom?
Honestly, that I'm not sure of. I think a large part would depend on how fast the person gets to the hospital. So if they are able to receive antivenom immediately, as opposed to delaying treatment. But that is something that I could look more into, ask our specialist if that person would like further information.
Okay. And that's something that they could email you about further?
Yes.
Perfect. Are the suggested OTC pain relievers topical or ingestible? I believe this was in relation to the scorpion portion of your segment.
So you could use something ingestible like ibuprofen, Tylenol, Advil, things like that.
Okay. Somebody wants to know, can you die from a Gila monster bite?
Again, I think that would depend on just the severity of the symptoms that people are seeing. So whether it's a Gila monster, a scorpion, a rattlesnake, bites and symptoms are not the same. It varies from person to person. I don't want to say that it's impossible, but I believe that with proper treatment and immediate medical care, that could be something that is avoidable.
Okay.
Mhm.
Does the AZPDIC also assess other hazardous materials accidents, or does that fall under OSHA?
So I'm also not sure about that one. I believe that it's so if it's something that happens, so for example, like the spill that poses a threat to the public, that would be something where we, of course, do assess and help with the management of that environmental event.
Perfect. And then last question at the moment that I see, tweezers have a problem, but how about fingernails stroked backwards to remove a stinger?
Um, so asking if you could use your hands to remove a stinger, I'm assuming that that's what that's saying. Um, we would suggest not using, bare hands. Um, Honestly, anything that you have could be used. So if it's a tweezer, if it's a comb, a flat-edged card, um, a butter knife, anything that can be, like they said, stroked backwards to remove the stinger.
Perfect. I think that about wraps up all the questions that we've received. I don't see any others. Thank you so much, Heather, for your time, and thank you for your fantastic. Oh wait, hold on. Can anything be done to lessen Sonoran desert toad presence on your property?
So these guys do like to be submerged in water. So we always recommend picking up any sources of standing water, and that includes picking up pet bowls that are outside. So we were actually at a school a while back doing a venomous critter presentation, and the teacher from the school was saying that she had one of her dog's water bowls outside, and the next morning she found a toad in it. So you just want to make sure to eliminate any standing water sources, and that includes water bowls for pets.
Definitely sounds like a good idea. Keeps the mosquitoes away too.
Yes.
Perfect. Yeah, like I said, thank you so much for your presentation. We really appreciate your time, and thanks again.
Thank you for having me.
Absolutely.